Going ahead, the next speaker of this section is Dr. José Alexandre Crippa. He's professor of Neuroscience and Behavioral Science Department of University of São Paulo, Ribeirão Preto campus. Please, Dr. Crippa.
Aqui. Good morning. Initially, I'd like to thank for the organizing committee for inviting me to be here, particularly Professor Jair Mari, who could group so many important people, especially for our country. This meeting is really, really important. I will talk about cannabidiol in neuropsychiatric disorder. In a few minutes, I will talk who doesn't know about this, but I'll talk about the research we have been conducting using this compound in the scope of our National Institute for Translational Medicine. Well, no, over there. I have to. The cannabis sativa plant has more than 80 cannabinoids, including both THC, the most well-known cannabinoids, but as well cannabidiol. And despite having quite similar chemical structure, both of them have quite different effects. These two main cannabinoids has been isolated and had the structure and partial synthesis conducted by Professor Raphael Meshulam from Israel. In fact, this professor has also discovered the endocannabinoid system, including both the receptors and the endocannabinoids as well. In particular, cannabidiol is a natural compound of the cannabis sativa plant, can constitute up to 40% of the extract of marijuana, is absolutely devoid of the typical psychological effects of THC, and there are evidence for anti-inflammatory, analgesia, anti-nausea, sedative, antipsychotic, anticonvulsive, neuroprotection, anxiolytic, among others. As well, cannabidiol can antagonize the THC effects when both contents are administered concomitantly. In 1982, actually, during his PhD here at Unifesp, Professor Antônio Zuardi, who was my supervisor during my PhD, ran some study that has shown that cannabidiol reduced both the positive and negative psychotic symptoms induced by THC. But the main question over there was, could CBD be antipsychotic by itself? Thus, he conducted an animal study in which he has shown that both haloperidol and cannabidiol were able to reduce the apomorphine-induced stereotypy in rats. But CBD did not induce catatonia, one of the main side effects of haloperidol. Later, in 1995, Professor Zuardi has published a case of a woman with schizophrenia successfully treated with cannabidiol. Then I appear from that part from now. We further showed that CBD improved the psychotic symptoms in some treatment-resistant schizophrenic patients. More recently, in fact, this year, in the first double-blind trial conducted by Professor Levesque and a group, Professor Levesque from Germany, that compared the effects of CBD with amisulpride, and they have shown that both compounds reduced the main PANS domains using both treatments, but CBD did not induce any side effect. We have also shown that the antipsychotic effects of CBD occur with CBD in the human ketamine model of psychosis. And then a big problem in terms of clinical for neurologists is that the psychosis induced by L-DOPA in Parkinson's disease patients. But giving an antipsychotic is problematic because it worsens the motor symptoms presented by these subjects, by these patients. So in agreement with some animal studies, we decided to test cannabidiol for the treatment of psychosis in Parkinson's diseases. And then we have found that CBD was effective, safe, and well tolerated for the treatment of psychosis in Parkinson's disease. More recently, we have just completed this study. We decided to test cannabidiol in Parkinson's without any psychosis in these subjects. And we have showed that CBD reduced the motor symptoms, only the motor symptoms in Parkinson's disease in a dose-response fashion in a 6-week double-blind trial. Therefore, cannabidiol has shown to reduce psychosis induced by THC, induced by apomorphine, induced by ketamine, induced by L-DOPA, and in schizophrenic patients. Then, as long as it seems to have antipsychotic, anticonvulsivant effects, we decided to test it in bipolar affective disorder. Initially, we tested in an animal model of mania, but we could not see any result both to prevent nor to reverse the mania induced by apomorphine in this animal model. In parallel, we could not also see any result in 2 patients with acute mania with psychotic features that has been responder of lithium. So it doesn't seem to work for this condition. In this study, the authors analyzed the THC-CBD ratios in the hair in cannabis users, in regular cannabis users. And they have shown that the groups with THC, the group with THC only in hair presented higher schizophrenia-like symptoms when compared to the groups with THC plus CBD and the non-cannabinoids group, highlighting that CBD may exert a protective effect on on schizophrenia-like symptoms in this population, and highlighting the public aspects of the different strains of marijuana consumed worldwide. In fact, it has been already highlighted by a researcher named Paris Hilton. I don't know why, but in 2008, she has launched a video. You can find it in the internet. It was 2008, a long time ago, 5 years ago, in which she mentioned, I'll read for you, socialite Paris Hilton, at the time 25, has launched a campaign to have cannabidiol content marijuana increased. It seems that she has read our papers, our work, so then she justified it by stating that a reduction in the amount of cannabidiol, a non-psychoactive cannabinoid which has antipsychotic properties, has been identified by Dr. Hilton as a major contributing effect to the psychotic breakdowns of Britney Spears. It's true, it's not the joke, it's really that. She was worried about the mental health of Britney Spears. Then, the same group I presented in the slide before recently reproduced and extended their findings not only to the psychosis, but also to depression, anxiety, and memory. But I will put for you now, it was in 3 years after, in 2011, the very end conclusion of the UCL researchers group. I'll read for you now. These findings raise concern for the harms stemming from use of varieties such as skunk, which lack any CBD but currently dominate the supply of cannabis in many countries. So she did not put the reference, Hilton 2008. She should mention, but was exactly what she predicted. It's funny, but it's not a joke. It's really, it happened. So we have also, in a collaborative series of studies, along with Professor Philip Maguire's groups in London, we observed that CBD and THC present opposites, not only behavior, but also activation, in brain activation, in different tasks related to psychosis, such as word retrieval, fearful faces, response inhibition, auditory procession, and in different areas also. As you can see, both of them has quite different opposite direction. So cannabidiol, in fact, both in animals and humans, not only seems to work for psychosis, but it has some studies have consistently shown that CBD has anxiolytic effects. Most of them has consistently shown this finding, this association, but it's interesting that the anxiolytic effect of CBD has a bell-shaped dose response curve. It's important for something I will mention later. In addition, CBD has shown an antidepressant effect, reducing the immobility time in the forced swim test, a standard test for depression, equivalent to the prototype antidepressant imipramine, and both of them increasing the BDNF levels in hippocampus. We also tested in Ribeirão Preto in a pathological model of panic attacks with a snake. We put the rat in contact with a snake, and 24 hours later, he has to contact again the snake. It's a very anxiogenic task. And also, again, CBD reduced both the physiologic but also the behavioral anxiety aspects during this task, this model. Then we decided to test CBD for the very first time in clinical anxiety, in pathological anxiety. Initially, we tested CBD in using a neuroimaging task with SPECT, and we have again seen that the anxiolytic effects of CBD in social phobics are mediated by a reducing in the activation of the parahippocampal gyrus, an area related to social phobia and anxiety in general. Later on, we decided to keep these studies, now using a task that my friends used to say that it's a torture, it's not a task itself. In this model, the social phobic arrive at the lab, stay for 15 minutes thinking nothing. We give them some magazines such as Caras, I don't know if we have abroad, Quem, Caras, Contigo, Hola, I think in the Spanish countries and others. Then that magazine, the subject has to remove the brain, put it apart, and put the brain again, 15 minutes afterward. So, and he or she doesn't know what they will perform, this task. And during this task, he received a TV instruction in which he has to prepare a speech that will be recorded in front of a video camera and will be recorded and analyzed later for psychologists. And he has 2 minutes to prepare the speech, and then he has to speak for 4 minutes. Of course, the anxiety goes up, and we monitor both the skin conductance and other physiological aspects, such as heart rate, and among others. And they perform the speech while watching themselves in front of the TV screen. Then what we observed was that the social phobic patients that received CBD presented lower levels of anxiety during the test and less negative self-evaluation as compared to social phobic groups that received placebo. This profile, no compound, no drug performed this to improve a cognitive aspect like self-evaluation during the test. And we got quite interested with these results. Then, based on animal findings, we decided to test cannabidiol for the treatment of cannabis withdrawal syndrome. We have given cannabidiol for a very, very heavy cannabis users, a girl, 19 years old girl, that used to present many withdrawal symptoms, cannabis withdrawal symptoms. and we hospitalized her and have given for 11 days different doses of cannabidiol. And using this compound, she did not present any withdrawal symptoms assessed by many different scales. As well, increased her cerebral blood flow using SPECT before and after the treatment. Here, I'd like to highlight that Professor Bressan, Professor Acioli Lacerda, and Professor Ronaldo Laranjeira, and a great team, are testing cannabidiol in crack cocaine users, based also in some animal studies, and possibly it can be a quite interesting compound for this very big problem in our country. Well, the SAGR strength has shown to be an animal model to study several aspects related to schizophrenia. It has PPI deficits, presents impaired social interaction, hyperlocomotion, deficits in contextual fears, conditioning, among others. And using this test, Levine, from the group of Professor Abilio here at Unifesp, has shown that CBD decreases the freezing responses, and also using different doses of CBD, suggesting the potential therapeutic effect of CBD to treat emotional processing impaired in schizophrenia. More recently, the same group, using the same model, recently decided to test the chronic use of cannabidiol in the same rats, but from the 30 to 60 day of birth, and they have accessed them at the 90 day of use. So what they are trying to do here is trying to check that giving cannabidiol during the adolescence would be able to prevent development of psychosis or schizophrenia. And for us, it was really surprising that CBD reverted the deficits presented in these rats. So possibly this CBD could be used in prodromals, for instance, or people at ultra-high risks for psychosis. There are no drugs that can perform this kind of condition, but maybe it would happen. Professor Philip Maguire in London has a project already approved for this, and maybe in a few years we will have some interesting data. Still in this trial, Professor Abilio group are also at my place at Ribeirão Preto are scanning the brain of these rats before and after the treatment, checking whether the CBD group also decrease the ventricular enlargement, trying to get an objective parameter for this antipsychotic profile in this group. So we, as my co-presenter, Professor Guilherme, we are also part of National Institute for Translational Medicine. And in addition to these studies I have presented for you, we have run many other studies, including inflammation, lung inflammation, collaboration with Professor Antônio Lúcio Teixeira from Minas and many other groups, lung inflammation, meningitis, and among others. And this raised attention from other groups, including Professor Raphael Mechoulam, that has been nominated for Nobel Prize this year, again, for the third time. And it was funny because he emailed us asking to collaborate, trying to develop new cannabidiol derivatives. I think that you are wondering, well, these compounds serve for almost everything. I mean almost, because for baldness it doesn't work. So asking for, it has not been in the market because it's impossible to patent it. It has more than 50 years, so any patent would be questionable. So this professor looked for us, proposed to synthesize new, quite similar CBD derivatives. Then we took it really serious because whenever we meet a hero, we're really happy when a hero tells us what they are doing, but I can say that it's much nicer when the hero come to us and say that is interested in what we are doing. So we went to Israel. This is my colleague Flavio Kapczynski that will be here on Friday. We met him for 3 days, many discussions. Here is the place where we discussed everything. In this paper, everything was written. We decided to do. And then we got an agreement from, we have a memorandum of understanding from both universities, more bureaucracy. And then I just have to show very quick this slide, but cannabidiol has proven to be, not cannabidiol, this derivative, actually there are 5 derivatives. They have proven to be from 40 to 100 more potent than the natural cannabidiol. So finally, last month, we could patent it, deposit it in US, so we are protected now. And we are, by now, performing the safety and toxicity studies with this company, and maybe after running some first-in-man studies, the big companies will take it from now. And also, there are 3 more compounds that are not patented already, that work at the CB2 receptor, and maybe a promising compound also. Luckily, in some months, I will be here again and showing some quite interesting results. It's a absolutely different way of working. It works in not only in the cannabinoid system, but also in others, and maybe could serve in Parkinson, depression, anxiety, diabetes, inflammation, tobacco dependence, crack users, so you can imagine, but baldness. So as a conclusion, although the mechanisms of CBD are still unknown, a considerable body of evidence suggests that it has antipsychotic, anxiolytic, and other properties. Also, it reduces weight also for women. We have shown also, so. However, clinical trials are clearly needed to confirm these possible effects in the treatment of different neuropsychiatric condition disorders. Thank you very much for your attention. That's it.
Thank you very much, Dr. Crippa. for your brilliant presentation. And we have time for one or two questions. No question?
Thank you for your wonderful presentations. The two things that came to my mind, the two scientific issues is, what's your contact with your collaborator, this young American lady? And since CBD does so much, how about hair growth? Is there anything in novelty in this thing?
Sorry, what?
So jokes.
Again, you can say.
No, I was thinking about your young American collaborator. You know, this lady in the bathtub that you presented here.
In which part?
Dr. Hilton.
Ele está falando da sua colaboração com a Paris Hilton.
Unfortunately, I did not have any collaboration with her. I'm available for that, as long as my wife allow it. But for science, we do many things. Maybe she could fund us. Maybe she could test in different conditions, like libido, sexual aspect. So, for sure, volunteers, there will be many for this kind of trial. We have, it's interesting because in our lab, Professor Zuardi, he has a rule in which anything you will give, any compound, and our lab is like, crazy stuff. We give, unfortunately, Jaime Halak is not here, but we give ayahuasca for depressive. Ayahuasca is a Indian beverage tea from the Amazon, which is hallucinogenic for depressed patients. We have given marijuana. It's a part of marijuana for most of them. Jaime has given a nitroprussate sodium to study psychosis, among others. But we used to say that we will be famous anyway. We will appear either at the National Geographic or in Datena, is a very popular criminal program here in the country. So I think for this Paris Hilton test, no volunteer there will be many volunteers. I lost my mind. Cannabis do some important. But Professor Zuardi say that anything we will give for a healthy subject, the first subject is you. So I can test it for the first time anyway.
She has one more question.
Hi, my name is Dieter Lammers. I'm from Denmark. I was wondering, do you think if they instead increased the CBD in cannabis in places where cannabis is legal, that might be better in terms of prevention?
Actually, CBD has more than, cannabis sativa has more than 400 compounds. There are some genetics modification for the drug dealers. They perform it. Normally, the skunk has very high strains of THC,
Yes.
and very, very low strains of CBD.
That's
So
why. Oh,
it's problematic. For instance, in some areas in South Africa, normally some areas that traces of CBD, almost no CBD. in that area, there are huge cases of acute psychosis induced by cannabis use. So it's something in terms of public health, especially in the countries and some states in which cannabis is legal.
Yes.
Possibly some countries, if they keep the regulation of this and allowing only for recreational use the cannabis with less THC, more CBD, it can in some way protect people from developing psychosis and panic attacks and other problems we are aware of.
Thank you.
Okay, thanks.
Thank you, Dr. Crippa, for your brilliant presentation again. Thank you.
Thank you.